Hi, my name is Melvin J. Ebo from Davao Doctors College, BSN 11C. In this video today, I will be demonstrating assessment of the eyes. Hello sir, good day, how are you? My name is Melvin J. Ebo and I am your nurse for today. May I know your name sir?
I am Christian Garcia.
Okay, what would I like to call you sir?
Just call me Chris.
Okay Sir Chris, may I know your birth date sir?
March 25, 1995.
Okay sir, I am here sir to do a set of observation in your eyes. So we're gonna be inspecting your visual acuity, your visual field, on what degree do you see the object, and we're gonna inspect your external eye structures, your eyelids, your eyelashes, and your eyebrows. And we're also gonna inspect your pupillary reaction to light, and we're gonna inspect for your cornea and your sclera. Do you have any questions sir or concern? Don't worry sir, because this assessment will remain confidential and adequate privacy is given to the patient. Assessing the visual acuity. Check for use of any visual aids prior to start the test. Do you wear any contact lens sir or eyeglasses?
No.
Had the client stand 20 feet from the Snellen or E-chart. Cover the eye being tested and ask him or her to read each line until he or she cannot decipher the letters of their direction. Took 3 readings, right eye, left eye, and both eyes. Record the readings of each eye and both eyes from the smallest line from which the person is able to read 1/2 or more of the letters. Can you read those letters, sir? Let's start from the top, sir. Cover your right eye, sir. First.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P.
Okay. And cover your left eye, sir.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P.
And both eyes, sir.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P.
Testing for visual fields. Face the patient directly at a distance of 60 to 90 cm or 2 to 3 feet. Instruct the client to look directly into the examiner's eye with both eyes. Place hands about 2 feet apart, lateral to the patient's ear. Slowly move wiggling fingers of both hands along the imaginary bone over the patient's head until the patient identifies them. Ask the client to tell you when the moving object is first spotted. Repeat the action in the upper and lower temporal quadrants. If a defect is detected, slowly move wiggling fingers from the defective area of the field toward the better vision. Repeat this at several levels until the border of the defect has been defined. Test other eye for an accompanying defect. Okay sir, just tell me sir if you can see my wiggling fingers.
I see. I see. I see. I see.
Visual inspection of the eyes. Inspect the eyes for alignment and symmetry. Inspect the eyebrows for hair distribution, alignment, skin quality, and movement. Inspect the eyelashes for evenness of distribution and direction of curl. Inspect the eyelids of surface characteristics. the skin quality and texture, position in relation to the cornea, ability to blink and frequency of blinking. Inspect the lower eyelids while the client's eyes are closed. Inspect the area over the lacrimal gland and lacrimal sac for swelling. Ask the patient to look up. Depress the lower lid of the patient with one's thumbs. Afterwards, to assess sclera and bulbar conjunctivae. Avert the eyelid to assess palpebral conjunctiva. Inspect carefully each iris and pupil. Just straight look at me, sir. Yes, sir. You can look up, sir. Just look up, sir. Yes. Inspect each cornea for opacities and texture. Shone a pen light from the side toward the eye, or shone a pen light at an oblique angle to the eye, and moves light slowly across the corneal surface. Ask the client to look straight ahead while doing so. Assess direct and consensual pupillary reaction to light. Assess each pupil direct and consensual reaction to light. Darken the room partially. Ask the patient to look into the distance. Shone a pin light obliquely to each pupil in turn. Look for direct and consensual reaction. Assessing the accommodation. Assess each pupil reaction to accommodation. Held an object, a pen light or pencil, about 10 cm or 4 inches from the bridge of the client's nose. Ask the client to look first at the top of the object and then at a distant object behind the pen light. Instruct patient to alternate the gaze from the near to the far object. Observe the pupil response. Ask the client to look at the near object and move the pen light or pencil towards the client's nose. So I will place a pen in front of your nose, sir. So first, sir, just look at the top of the pen and then look into the distant object. Okay, sir? Do it repeatedly, sir. Look at the pen, then look at the distant object. The pen, the distant object. Sir, just look at the pen, sir. Performing Hirschberg test. Assess ocular alignment arising from the extraocular muscles. From about 2 feet directly from the patient, shone a light into the patient's eyes and ask the patient to look at it. Inspect the reflection of the cornea. Look for direct and consensual reaction. Sir, just straight look at me. I will show a pen light in your eyes. Perform the cardinal field of gaze test. Assess extraocular movements. Look for normal conjugate movement of the eyes in each direction or any deviation from normal. Nystagmus, lid lag, and convergence. Stood 2 to 3 feet in front of the patient. Ask the patient to follow the examiner's fingers or a pencil while making a wide H in the air. Look for jerky movements, nystagmus on lateral gaze and an upward gaze. Watch a rim of sclera between the upper lid and iris as the eye move up and down. Okay, sir, I will place a pen here, sir, in front of your nose, sir. So just follow where the pen is going, sir. Okay, sir? Okay, very good. Testing for convergence. Ask the patient to look at examiner's fingers as the examiner moves it toward the bridge of the nose. Check eye convergence. Just look at the pen, sir. 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 Here is the summary of our findings, sir. So when we assess your visual acuity, sir, you can read the 20/20 in the Snellen chart, which is your visual acuity is normal. And when we assess your visual field, sir, your peripheral degree is 90, which is you can see 90 degree here in your right and 90 degree here in your left, and 50 degree here in your upper, and for your lower part is 70. And your nasal field vision, sir, you have a degree of 50, sir. When we assess your visual inspection, sir, the hair distribution in your eyebrow is normal and symmetrical. And eyelashes is slightly curved upward and able to blink normally, which is normal, sir. And lacrimal area has no swelling, which is normal. And the conjunctiva is transparent and sclera color is white. And the palpebral color is pinkish, which is normal, sir. And when we assess your iris and pupil size, you have symmetrical, sir, which is normal. And when we assess the consensual pupillary reaction to light, the illuminated pupil has constrict, and also the non-illuminated pupil is also constrict. And when we assess the accommodation, sir, the reaction of your pupil when you look into the near object or into the pen, your pupil, sir, has constrict. And when you look into the distant object or the far object, your pupil has dilate. In performing the Hirschberg test, sir, light falls symmetrical within both pupils. When we also test for your cardinal field of gaze, both eyes are coordinated, move in unison with parallel alignment. So there are no jerky movement, which is considered normal, sir. When we do the convergence of the pupil, sir, the pupil has converged when the object is moved toward your nose, which is your pupil is normal. So overall, we have a very good assessment, and which is your eyes movement is normal and your external eye structures are symmetrical, and both pupils has constricted and dilate when you look into the far object. So it is a very good assessment, sir. Sir, do you have any concerns or questions, sir, about the assessment, sir?
Nothing.
So thank you for your cooperation, sir, and wish you the best.